Are you ready to transform your receding hairline? Receding corners can really decrease your confidence. Let us discuss a case today in which the patient wanted to get something done for the receding corners. Now, I will give you all the details of the case and then we'll decide together what would be the best treatment of such a patient. But before we go further, let me just give you a clue about if you want to see your hair transplant results without actually undergoing the surgery. Now you can take help of PKI feature of Saraswat Hospital app. I'll give you full details in the middle of the video. My name is Dr. Preeti Saraswat and I'm American board certified hair transplant surgeon serving in Saraswat Hospital, Agra. Do subscribe to this channel if you want to see more such educational and informative videos. Our today's patient was suffering from progressive baldness for past 4 to 5 years. When we asked about his father, he said his father also suffered from baldness, but not this much and at a later stage. Now let us consider the scenario. The grade of baldness for this patient, you can see on the screen, is grade 2 Norwood Hamilton. When we did a trichoscopy for him at the time of consultation, which is very important, during the trichoscopy we found that the density of hair at the donor area was good. It was around 80 grafts per centimeter square. The average diameter of hair at the donor side was around 0.078 millimeters. There was sufficient donor grafts at the donor side. The density we wanted to give for the front was around 40 centimeters square. If we try to give more density than this in the first session only, then because of the dense grafts, the survival rate of grafts may not be good. Now on the screen, we are showing you the marked area which the patient wanted to be treated. The question here is whether you would like to go for scalp micropigmentation in this patient or a hair transplant. You can write your answers in the comment section below. The correct answer would be a hair transplant. Why? Because अगर हम यहाँ SMP करते हैं scalp micropigmentation, तो the dots of scalp micropigmentation will stand out. It will not look good. So, because he has sufficient number of grafts at the donor area, we can take out the required number of grafts and transplant them in the recipient area nicely in an artistic way so that we give a softer hairline with proper frontotemporal angles and we give a dense area towards the middle of the scalp. So for this patient, the number of grafts required was around 1900 grafts which we transplanted in single session. That means in one day only. If you want to ask any questions regarding your hair transplant, you can ask in the comment section below or you can WhatsApp us on these numbers or you can call us for consultation. On the day of surgery, we made the slits first. With the means of a slit counter, we knew exactly how many slits are made and how many grafts are required. Then we harvested the grafts by a low torque, low RPM FUE machine so that the grafts which we have are sturdy and they are good. Next, we transplanted the grafts in the recipient area in the pre-made slits. The patient was given a packet of medicines and they were told how to use them, how to wet their hair, proper post-op instructions were given, and then they went home. They were given phone numbers of a few of our staff also so that they could call us whenever required. Patient came for review after 7 months when we did his PRP also. You can see in the pictures here that the results are good, but there are still hair to come because it is only 7 months till now. Now you can see the results at 1 year. The patient is happier, confident, the hairline is well defined and age appropriate. Now let me discuss the PKI feature of Saraswat Hospital app in which you can get the projected results of your hair transplant in 3 quick simple steps. Download the app, click on the PKI feature, upload your pictures. You will get a mail with your photographs within 24 to 48 hours. These pictures would have been reviewed by ABHRS doctors, which is me and Dr. Satya Saraswat. Not only this, you would be told approximate number of grafts which would be required by you in your procedure and also a few questions which you should ask your consultant doctor when you go for hair transplant consultation so that you also take part in the long-term treatment and planning. A few of pearls from today's video would be: number 1, when you go for a procedure, please see the credentials of your doctor and the clinic also where you are going. Also see testimonials of a few of patients who have got their hair transplant done there. What do they say, how their results are, and also see for long-term treatment and planning. For example, in this patient, we suggested some medical treatment also for the rest of the hair. And last but not the least, see whether Here, the clinic provides you with long-term handholding so that you are happier and more confident by the day. If there is someone in your family who needs a hair transplant, do share this video with them so that they may also be benefited. If you want to know cost of hair transplant, please click the video on the left, and if you want to see our latest hair transplant video, please click the video on the right.